So why are we worried about diabetes and coronavirus? Why do we need to be careful? And what actually it does to make somebody prone to have coronavirus? So basically, as you know, in diabetes, the person's immune system is a little low and his blood sugars are actually quite high. And that high blood sugar level itself makes him more prone to catch any infection. And coronavirus is no exception. If someone gets coronavirus, being diabetic, he or she may be likely to get slightly more severe infection than the rest of normal people, and the healing process is a bit slow as well. So you can imagine if you have a very good control of your diabetes, so your HbA1c, the 3 months average percentage is pretty good right from beginning, your chances of having very severe infection or any complications from coronavirus are quite low. So it's quite important to have good HbA1c and overall good diabetes control anyway. So let me give you some safety tips here. Make sure that you stock up your tablets, not just for diabetes, but also your insulin, at least a week's supply in advance. You need to make sure that you've got some common tablets like for fever and coughs and cold. So make sure you've got some paracetamol and other things that you normally use if you're ill. It is very important to have what we call as hypo kit, which is your hypoglycemia kit. So when your blood sugar drops low, you can actually just go to that kit and have something handy. So keep something like white sugar and honey, or even glucon D, or something like um, quick acting carbohydrates, which you normally treat yourself. So jellies or sweeties. So have the hypo kit handy in emergency. Make sure that you have an emergency contact of some person, either family or friend or even a neighbor, in case you need some emergency service. You need to have your doctor's contact handy as well, and tell somebody else in the house if you're not feeling well whom to contact in emergency. So all these things are very important. And if you plan ahead well in time, things may not be as bad as you think. Now, coming to physical health, being in lockdown and people are not as active, it's easy to gain weight. So it's quite crucial to keep an eye on what you actually eat, making sure that you have not too much of carbohydrates, but balancing that with a lot of proteins and fruits and vegetables. So having a good diet is important. Physical exercise is also important. So even if you're at home and unable to go out, you can do some stretching and some weight training or some resistance exercises at home. If you've got a treadmill, that's great. But if you haven't, then something is better than nothing. And International Diabetes Federation, if you Google IDF, they've got a good list of exercises that you can actually easily do at home to keep fit. So diet, exercise, making sure that you drink plenty of fluid. So hydration is very important, especially being summer and quite hot temperature outside. Hydration is very important anyway, even if you feel unwell. So in your sick days, make sure that your fluid intake is at least 2 to 3 liters per day. Now that advice may vary if you are a CKD or chronic kidney disease patient, but just for general diabetic patients or anybody, fluid intake is quite important throughout the 24 hours. Now, after physical, it's quite important to keep your mental health good as well. Now, we are all feeling anxious, emotional, sometimes depressed, and a little bit worried about future, aren't we? So, in this period, it's quite important that you have the mental balance. So you can do yoga, you can do meditation, anything that works for you, but keep your mental health strong. Physical and mental health are very linked. So if your mental health is affected, it can actually impact on your physical health as well. So look after that. Make sure you monitor your blood sugars regularly, even if you're not on insulin. At least you'll get an idea as to is it going extreme, so very high or very low, and know when to actually contact your doctor. So if your sugars are persistently above 300 or 250 milligram per deciliter, or if they're dropping below 70 milligram per deciliter. So any extremes, you should know what to actually do. Now, there is something called as ketone strips, which we often advise for our type 1 diabetic patients who are on insulin, but it is given to certain type 2 diabetic patients as well. So have this discussion if you're not aware of this with your doctor and know how you can use it if you're ill. Make sure that you check your temperature regularly if you feel unwell. And the most important thing is do not panic if you're ill. Stay healthy, stay positive. Thank you.